Hi everyone. The purpose of this video is to talk about the compassion crisis, burnout, the measurable effects that using compassion can have on patients, and some techniques to efficiently introduce compassion into practice, specifically with IV placement. The idea of a compassion crisis refers to a phenomenon reported by patients and only appears to be getting worse in the U.S. healthcare system. This is common across all areas of healthcare. Essentially, there is a noticeable lack of compassion in interactions with healthcare workers. On the other side of the coin is the provider. Some of the hallmarks of the compassion crisis, from their point of view, are emotional exhaustion, lack of personal accomplishment, the economics of healthcare are becoming increasingly apparent. The expectation is more patients seen and provided services to in less time. It is vitally important, however, to not lose sight of the fact that the patient-provider relationship is not like other customer service interactions. It's much deeper than a simple transaction. So it is incumbent upon us as healthcare workers to find ways to respect this relationship and reflect on our own practice in order to find ways to efficiently incorporate empathic communication during our interactions with every patient, every time. These are some of the themes found in comments on patient surveys when asked about IV placement at Rush University Medical Center. Obviously, we are not intending to have patients' experiences be like this. Nevertheless, it is what is occurring. Fortunately, effective communication can mitigate many of these and make the ones that are sometimes unavoidable, like multiple attempts needed for a difficult IV stick, better or as good as they can be for patients. Ultimately, the preoperative period, that immediate period before surgery, can be, without exaggeration, one of the most vulnerable moments of people's lives. So, it is vital that we put some communication techniques in place, the same way we use techniques on actual IV insertion in order to make sure patients feel cared for and at ease. In a large survey, 87% of patients say that kind treatment by a healthcare worker is more important than wait time, travel distance, or cost. In this next section, we'll talk about the effects of compassion on patients, both physiological and psychological. We use lidocaine injections to numb up the area before we place the IV, and therefore lessen the pain with insertion. But believe it or not, we can actually get similar effects with just our voices and the way we talk to patients. Dr. Bhivanendran, the head of the anesthesia department at Rush, participated in some studies which examined the effect of courtesy during blood draws and how it related to perceived pain during that blood draw. It was found that just simple courtesy during blood draws was found to have an outsized effect and significantly reduce the pain that patients felt. Now, blood draws are not exactly IV placement, but it's a similar concept. I like to call this mitigation of pain the vocal local. Two medicines we give in the perioperative period as anesthesia providers are opioids and anxiolytics. One deals with pain, the other with anxiety, as the name suggests. Now, I mention this because several studies have found that compassion shown to patients can actually have physiological effects due to the release of endogenous opioids. The release of these endogenous opioids have modulating effects on pain transmission, and this is by your voice and your words alone. An additional study showed a 50% lower requirement for opioid pain medications following surgery in the experimental group who received enhanced compassion before surgery. In the same study at Massachusetts General mentioned earlier, it was found that empathic communication before surgery actually had a greater effect than sedating medicine to keep patients calm. Compassion is like a superpower. In this way, you're actually influencing their vital signs and stress response by your word alone. Even though we neatly divide the perioperative period into sections pre-op, intra-op, post-op, it is actually a continuum, and your compassionate actions before the procedure can have beneficial effects throughout the entire thing.
Empathic communication is important because patients can tell if people care essentially immediately. The case study of Dr. Edward Viner, a physician who underwent a harrowing experience in the ICU, illustrates this point excellently. While he was on a ventilator, he said at each shift change, when a new nurse would come in, he could tell whether they cared within 1 minute. He credits those nurses who showed compassion and did care with giving him the psychological wherewithal and willpower to become strong enough to get off of the ventilator. Following this experience, he went on to form the Center for Humanism at Cooper Medical School at Rowan University. He's now devoted to figuring out how to infuse compassion training into medical education.
Another example of the profound psychological effect that compassion can have is illustrated by the use of child life specialists in a variety of departments around the hospital. Their specialized training allows them to create an emotional connection with the child, putting them at ease in the acute moment and actually preventing the traumatic experience from setting up as long-term PTSD down the road. There is no magic medicine or expensive treatment. This is simply applying empathic communication techniques and addressing the concerns of the child. This leads to a myriad of realized benefits in the current moment and unrealized ones later down the road. A quote from Kenneth Schwartz sums up the effects of compassion succinctly. You may recognize this name as the founder of Schwartz Rounds. This is a national program in which healthcare workers meet and discuss the social, emotional, and ethical issues surrounding care. He said that compassion is not just nice to have, rather, it is imperative in healthcare and has the ability to make the unbearable bearable. All in all, increasing compassion increases the quality of what we are doing.